All right, we are here at the Forbes Healthcare Summit, the first of what I'm sure will be many, and we're speaking with Ted Meisel. Ted, well, a few things we have to tell you about Ted. For starters, he is the true nature of a serial entrepreneur. He's been in more interesting businesses, all of which, or certainly most of which, have been incredibly successful. Ted, interestingly, is also a board member here at Forbes as a senior advisor at Elevation, correct? So what we really want to talk about are the investments that Ted's been making in the healthcare field. Not surprising that we would talk about this since we're here at the Healthcare Summit. Ted, first, welcome.
Thank you, Rick.
Very nice to get a chance to speak with you.
Terrific to be here.
Good. So what we want to hear about is what you're finding exciting and what you're doing in healthcare.
Well, first of all, as you mentioned the disclosure before, I should say that what I'm doing in healthcare is independent of Elevation Partners. So, you know, my journey in healthcare started about 6 years ago when I joined the board of a not-for-profit organization called Hope Street Group, which focuses on catalyzing change in healthcare, education, and jobs. We did a big piece of work on reinventing primary care. And as we were doing that, my entrepreneur alarm bells went off. And here's why. So the ingoing assumption was we're about to pass the Affordable Care Act. We're about to add 30 to 40 million people to the rolls of healthcare. We must need a ton more primary care doctors. Right. And that on top of a shortage we already have. Right? And so, but the entrepreneur bells that went off and said, wait a second, in every other industry, right, when faced with a skill shortage, what do? We don't necessarily just train a ton more people. And oh, by the way, training a doctor takes 10 years even if you have the people to do it. Right? So what you do is you figure out how to lower the cost, how to shift to lower cost people, how to make sure, how to take and elevate your experts so that the work they're doing is far more productive. Which is interesting to primary care doctors because on average they're the lowest paid of any doctors.
But wait, let me ask, when you say some of the things you're talking about changing, are you talking about changing it systemically so there's more reliance on, say, nurse practitioners, physician assistants? Is that the focus?
That's correct. And by the way, let's take that all the way to the consumer, right? Let's get information into the hands of the consumer or the patient so that they're more engaged in their care, or at least the decisions related to their care. So that's exactly right. And by the way, when we do that, we'll increase the quality that we provide and maybe even increase the length of people's lives, and we'll lower the cost.
How are you going about this? What are you doing, if I could say precisely, to increase the number of people working in that pecking order of a primary care doctor?
Yeah. Healthcare is immense. 18% of the economy, millions of people engaged in it. And, oh, by the way, as a parenthetical, 18% compares to the next highest country at 12%, right? So we got to cut, we're spending a third too much on our healthcare. Okay, so what I figured I'd take, and thank you for the kind words earlier, I'd take my background in information technology, in expert systems, in the internet, and apply it to healthcare decision support.
Actually, I'm going to interrupt you because your background in information systems is not incidental. You should tell people what you did in that area.
Thank you. So, well, first of all, I was trained in all the obsolete languages of today. So I'm immensely unqualified on that front. But what I did do from understanding how essentially how technology was put together was to help build two significant internet companies, one called CitySearch, which ultimately became part of IAC, Barry Diller's internet empire, and a second one called Overture, which made search an actual business. And many people don't know this, but we actually beat Google to the $1 billion in revenue mark.
Not only that, but as I recall, you sold Overture for $1.6 billion, making it one of the first truly big payoffs in this world.
That's correct, and we sold it to Yahoo, and the Overture division became part of Yahoo, where actually it grew to be much bigger than that at the time. And you may know that internet search and search-related advertising still represents almost half of online advertising. That is changing.
So I took you a little off course because I really wanted people to understand your background in this. But let's go back to what you are doing to deal with the problem of the shortage that we absolutely currently have with frontline doctors, and which clearly is about to become a more serious problem as more people come into the system.
If you think about the way patients encounter the healthcare system, they trying to stay well, they may need to be diagnosed, they may have a decision to make if they've been diagnosed, they may need to get treated, right? And they may need to deal with, unfortunately, we all will at some point, end of life care. Right? There are angles on all of those problems. I've been focused largely on the treatment decision and care areas to date. And so I have currently have 4 companies that are providing decision support. One company provides what's called shared decision making. By the way, I've been on this healthcare journey for 3 years. I found when I first encountered the term shared decision making, I found it odd, because what it says is that it's a new field and a new idea for the patient to be engaged in making a decision about the most appropriate care for them. Right? And we can all, I think we all get the irony behind that. But Wiser Care has a unique approach to giving the patient the information they need to make a decision about which treatment is best for them.
Is this delivered via app, via software?
All of this is via the internet.
Okay.
Okay? And the app versions will follow in everything I'm about to describe.
But today it's a destination I can go to an address.
Correct.
Online.
Correct. Currently also delivered through healthcare providers.
Okay.
Because, of course, it's shared decision making with the physician.
Right.
And because healthcare is tricky, and so the first time we do this, we'd like to put this, we'd like to put the decision next to a physician as we go through it. So Wiser Care just launched with North Shore University Hospital System in Chicago and UCLA in Los Angeles.
Now, to the best you can, without having a visual demonstrator here, walk us through how this is going to work. I'm a patient.
Sure.
I can go to the site. What do I do then?
Sure. So I'll take you back a step further. Okay. So let's say, I never like to refer to you when I'm describing this because it involves someone with disease. So let's say Mr. Smith has an elevated PSA, is referred to a urologist. Urologist does a biopsy, gets the test results back, finds out that unfortunately Mr. Smith has cancer. Today, the urologist would call Mr. Smith and say, unfortunately, I have bad news. There are lots of treatment options. I'd like you to make an appointment with my staff to come in. We'll walk through your options. And today, that appointment typically is allocated 20 minutes. Right? And what a patient really wants is an hour and then a follow-up hour.
And probably a lot more hours after that.
After that, exactly. Right? So look, what we try to do is prepare the patient as best we can for that discussion, to bring them up to as far as we can to the doctor's knowledge and the way a doctor would approach that decision.
So.
And shall I describe that?
Please, yeah. Well, actually, I'm going to jump in and make a point on it because it's a good place to do it. I don't know if this is what you found, but I have found, actually through some personal experience, when patients get a diagnosis like this, there's nothing much they can do. They feel powerless because it is what it is. But the one thing we can do in this age is we can go to the internet, because if nothing else, we feel that we can get smarter. We can know more. And it's the only thing we can actually affirmatively do. Is that really what's at the heart of this?
It's a great point, and taking control for patients is a big issue. But in addition, in healthcare, that might or ought to be enough, but that's not enough for economic viability. Right? And so Wiser Care also makes the visit with the physician more efficient. And
information is provided ahead of time for the physician to know.
That's right. And by the way, you mentioned that patients go to the internet. Right? They often do today, and we'll talk about this in other contexts also. But they do. They bring in a stack of documents and they say, "Oh, doc, what about this study? What about this new therapy?" Right? And so the doctor, instead of getting to the heart of the matter, is often forced to spend time
deflecting.
In a sense, playing defense.
Yeah.
That's right. That's exactly right. So you asked me how Wiser Care actually works, and it's pretty simple. Patient is invited to come to the Wiser Care by his or her doctor. Mr. Smith logs in, enters a few pieces of information, because believe it or not, there's not that much information that defines disease. In the case of prostate cancer, it's approximately 10 pieces of information. Then we lead the patient through an interview. And in the interview, we're able to help the patient quantify his preferences. What do I mean by preferences? Well, each treatment comes with probability of success and probability of side effects. Right? And so in prostate cancer, there are 4 main treatments and essentially 10 dimensions of success and side effects. And that's a lot of data for a patient to keep in his or her head. So we quantify the probability that the benefits and side effects may happen under each treatment. We quantify the patient's preferences, right? And then we can deliver to the patient a score for each of the potential treatments, right? And the data behind it. Now the patient can sit and read that, and now the patient walks into the doctor and says, okay, I have the baseline.
You've helped the patient know his own mind, so to speak.
Exactly. And for the doctor to understand where the patient's coming from. Doctors aren't necessarily trained, nor do they always have the time to extract patient preferences. And it's one of those areas of decisions that you may not know in an instant how you feel about trading off important side effects.
How do you monetize this?
We offer it through providers, through doctor groups, and that are interested in shared decision making, and they pay on a per doctor per module, like prostate cancer, per month basis. We like to do it that way so that we encourage usage.
Are there enough choices and enough diagnoses to make that work out? Prostate cancer is a great example because there are a lot of choices and different things that may feed into what you think is best for you. When you get to heart issues, there are some choices, but they tend to be more limited, aren't they?
They are, though, as we've done the analysis, and I should mention, I'm a co-founder of this venture, but really one of my partners, who's the brains behind it, is a health services researcher, fellow at Rand Health, the UCLA faculty, and we've identified 100 preference-sensitive conditions that represent the majority of the cost of care in this country. So not all have 4 choices branching to 10, but all have, even a choice of 2 is a significant choice for a patient.
I want to, because I know you have a lot of children, if you will, in this, and I don't want you to have to play favorites. Tell us about your next venture.
Yes, thank you, Rick. The next venture is HealthLoop, founded by a doctor in San Francisco who's very entrepreneurial, and HealthLoop. HealthLoop deals with the 99% of time that patients are out of the office. So when you're in the office, you're often there for a reason, and the doctor will prescribe you something to do in order to get better or manage your condition. Right? And then you leave the office, and the doctor has no idea what you do in the intervening time. And the patient remembers whatever instructions they happen to remember. We've all had that experience.
Or want to remember.
Right, exactly. Right? And often is unsure about when to contact the doctor depending on what goes wrong. So in HealthLoop, what happens is we work with the doctor to design protocols that the doctor can assign to individual patients. Doctor assigns that to a patient. The protocol consists of observations to take, pain, for example, temperature, swelling, blood pressure, right? Includes education material as needed, includes things to do, right? Like change a dressing, take your medication, right? And delivers all that exactly when the patient needs it, okay? On the PC, on a smartphone, right? So now the patient knows exactly what to do when they need to do it, and in the future we'll be able to provide conditional instructions.
Is it in this age now where hospitals stand to suffer immensely with recidivism, if a patient has to come back within 30 days, this sounds like this is your customer, that hospital.
It is, and and though I want to make clear that in some cases we think patients will use this on their own, increasingly, by the way.
Just to do it correctly.
And in some cases it'll be decision support, if you will, to non-doctor, maybe even non-nurse staff that helps to track the patient, especially in high-risk situations.
It's interesting. I'm seeing this more and more. Larger physician offices do have people now whose job is follow-up. This is what they do. They will call you within a day or two and say, did you do this? Did you remember this and that? I think it's very smart. I think it will save money in the long run and is a far more efficient way to use physician time. But hospitals, it sounds like, truly stand to benefit from this program.
Truly stand to benefit, because as you mentioned, they will now be on the hook for patients in a number of conditions that they've discharged if they come back to the hospital within 30 days.
Interesting. Any other healthcare children you want to talk about?
There are, in fact, yes. One is called HealthFinch, based in Chicago. Founded by one of the country's leading healthcare IT and informatics docs. And Lyle Berkowitz, Dr. Lyle Berkowitz is a primary care physician and has set out to solve the problem of all the clinical but non-patient facing activities that doctors need to do. Takes up about half their time, right? Like prescription refills. Right? Typical primary care doc.
What you might call doctor annoyances.
Has 30 to 60 minutes of prescription refills to deal with at the end of the day, if they're doing them the right way. And often they delegate them to staff, and in some states they can, in other states they can't. And even then, that staff's relatively expensive, something that we really can automate. So HealthFinch automates that process, and in most cases, through the EMR that the doctor's already using. We have partnerships with several EMR providers at the moment. So and we've got on the docket several other tasks behind that to automate.
So this is trying to make a doctor's life a little bit easier.
We hope a lot easier.
Right.
And this is 50%, and if we can make a meaningful dent at that 50%, we can.
You're creating more time for that doctor to see patients, more revenue for the doctor, better for patients.
And put some joy back in primary care practice.
Which is really all but gone, isn't it?
I think it is.
And what else? I know you have another one.
I do. Doctor Evidence. Doctor Evidence is a platform that allows a professional, so this is not for consumers at this point, but a professional to compare any two or more therapies for any studied population against any given set of outcomes. It's quite sophisticated. It's essentially automating the process of systematic reviews. Typically, those are reviews issued to big consulting firms, and they cost between $150,000 and $300,000. And Doctor Evidence is making them far more functional and effective for pharma companies, device companies, and provider policymakers to use over time. What do I mean by the latter? For example, clinicians that establish guidelines for their healthcare systems. Right.
So I know you need to get back to the conference, but the last question I will ask you, do you see these kinds of businesses at a stage now where they're going to start to become profitable? Is it far off in the distance? When does technology like this really begin to solve the problems that you're trying to solve and make money?
Yeah. So I think that this healthcare technology is hard because, as we discussed on one of the panels that just ended, there's an extra year of validation, if you will. And so investors need to be patient. On the other hand, compared to my old technology world, where there might be 10 of each of the companies I just described, there's one, maybe two. Right? So the payoff can be there in less competition. Doctor Evidence is now essentially profitable.
Is that right?
It's
How long has it been up and running?
well, it's been 6 years, which is not insignificant. I think these other companies will be shorter. There are changes taking place that will lead to it. The game really changes for all of these when payers decide that they can save money by investing, by making these services available to consumers. And these are essentially interventions that will all save money, right? But we know we're going to have to do our homework.
Are you making headway with the payers yet?
Actually, we are. There's great interest. They are all running, in a sense, experimental programs to test new technologies.
Mostly private market? What about government?
Well, yes, I was talking about the commercial market. CMS is running programs, although my critique there would be they're so eager, understandably, to scale technologies.
They want to get there quickly.
That they're probably skipping too far ahead of new technologies that are even more promising.
Right. Interesting. Ted Meisel, thanks so much for talking with us. Very interesting stuff. I hope we get to do it again because I want to hear how these companies are proceeding as time's going by.
Thank you, Rick. Pleasure to be here.
Great to have you. Here at the Forbes Healthcare Summit with Ted Meisel, we're going to have more.